introduction of the participants of this workshop. So please welcome again to this beautiful city of Kigali, and please be brief and explain from which organization you are here and what is your role in specifically in vaccine rollout program in your country, in your or if you are an implementing partner, which activity area you are going to cover with the CLL program. So let me start from here, then we'll go all around. So maybe Asad.
Thank you. Good morning.
Thank you, Asad.
Good morning. My name is Professor Suleiman Mboup from Senegal. I'm the president of IRSF. IRSF is an implementing partner for the surveillance.
Bonjour à tous. Je suis professeur Bénier Bivro-Joseph. Je suis le directeur de l'Institut national des jeunes publics. C'est l'institution qui est en charge de la gestion des urgences de santé publique. Et de ce fait, je coordonne la lutte contre la COVID en Côte d'Ivoire. Donc, nous sommes impliqués dans la vaccination contre la COVID. Merci.
Thank you.
Bonjour, je suis Dr Kone Amedou. Je représente le directeur du programme élargi de vaccination du Côte d'Ivoire. Je suis responsable de la surveillance des maladies cibles du PEV et investigation. Je suis également membre du comité de coordination de la vaccination, de la vaccination COVID au niveau national. Voilà, membre du secrétariat également du comité des experts. Voilà, et responsable ici de la sécurité des vaccins au niveau national. Je vous remercie.
Good afternoon, everyone. My name is Mosoka Fala. I work on the SLF program as the team lead for the country engagement and technical assistance. Thank you very much.
Dr Moussa Assa, from the Institut de recherche en santé, surveillance et épidémiologique et formation, or IRSF, Senegal. We are leading the safety surveillance effort in West Africa, Central Africa, and North Africa. Thank you.
Good morning. My name is Dr. Julius Gideyanen. I'm from Liberia, and I serve as the Deputy Director General for the National Public Health Institute.
Thank you.
Bonjour à tous. Je suis Dr. Eugène Yala, directeur du programme vaccination Guinée-Bissau. Et membre du groupe de coordination de lutte contre le Covid. Et français c'est mauvais, mais portugais c'est bon. Comme ici, quelqu'un parle portugais, c'est pour ça.
Good morning. My name is Bruno Silva. I'm director for Center Development Center, National Institute of Public Health. We help in the national program to vaccination. Thank you.
Bonjour, je suis Gori Yapi Marcel, médecin, coordonnateur santé au niveau de la Croix-Rouge de Côte d'Ivoire. Ici, nous sommes en tant que partenaire de mise en œuvre, surtout dans le volet communication sur les risques et engagement communautaire. Merci.
Bonjour à tous, je suis Dr Nana Kwadio, le secrétaire général national de la Croix-Rouge de Côte d'Ivoire. Je suis le premier responsable administratif de la Croix-Rouge de Côte d'Ivoire. Je suis le coordinateur général des opérations de la Croix-Rouge de Côte d'Ivoire. Merci.
Good morning, Enos Ongoma is my name, from Kenya Red Cross, Grants Manager. Kenya Red Cross will be in charge of, is a level 2 partner, will be in charge of implementing and coordinating RCC. Thank you.
Bonjour, je suis Thierry Ballois, je suis chef de cluster d'Afrique centrale et de Niamey. Je supporte les sociétés nationales Croix-Rouge camerounaise et Croix-Rouge de Côte d'Ivoire. Je suis la Fédération internationale de la Croix-Rouge et du Croissant-Rouge.
A very good morning to you all. I'm Oscar Okumu from Kenya Red Cross Society. And like my colleague has said, we are the second level partners and we spearhead 14 national societies or countries in implementing the RCCE component of this wonderful program. Thank you.
Good morning, my name is Mohammed Babikir. I am head of Nairobi Country Cluster Delegation based in Nairobi in Kenya. My role is to support Nairobi Country Cluster covering Kenya and Somalia, and both of them are part of this program. So with Kenya Red Cross also being the lead applicant for the East Africa Red Cross, Red Crescent National Societies, about 13 national states, and we do provide support in terms of technical and coordination to these national states. Thank you.
Good morning. My name is Rui Oliveira. I'm the Regional Operations Manager for the International Federation of the Red Cross and Red Crescent Societies, also based in Nairobi. I'm also responsible for the implementation of the IFRC COVID-19 response in support of all national societies in the Africa continent. Thank you.
Good morning, Itonde Kakoma. I serve as the permanent representative of IFRC to the African Union. The IFRC is a level 1 partner in advancement of the risk communication and community engagement as a part of the SLL. We're honored to be here with you. Thank you.
Bonjour, Jean-Urbain Zoa, secrétaire général de la Croix-Rouge camerounaise. Je représente la Croix-Rouge camerounaise qui est le leader de 9 pays Afrique centrale dans le domaine de la communication des risques et engagement communautaire. Merci.
Bonjour, je suis Armel Onogo, responsable des projets de la Croix-Rouge camerounaise.
Ali Abdurrahman Osman, Director of Public Health, Somalia.
Bonjour, c'est Dr Boli Amadou du Mali. Je représente ici le directeur de l'Institut national de santé publique. Cet institut est en charge de la coordination de la réponse COVID au Mali. Merci.
Bonjour, moi c'est Yacouba Mahamadine Diko, je suis logisticien de santé. Je représente ici le directeur du programme élargi de vaccination du Mali. J'ai en charge la gestion des vaccins, équipements et matériels de la chaîne de froid au niveau de la Direction générale de la santé. Je suis également membre permanent du secrétariat du groupe technique pour la vaccination GTCV. Je vous remercie.
Good morning. My name is Chidimai Fepe from the African Medical Supplies Platform. Under the SLL program, we will be supporting the African Union member states with procurement and distribution of PPEs. Thank you.
Bonjour, je suis Dr. Luc Salva Eredebona. Je suis le coordinateur technique national de COVID-19 en République centrafricaine.
Thank you. Good morning, all. My name is Dr. Priscilla Ibekwe. I'm a Director of Special Duties at the Nigeria Center for Disease Control. Thank you.
Good morning, everyone. My name is Agwambi Nelly. I work for Global Health System Solution. I'm a licensed legal practitioner. I ensure compliance. I work as a director of operation. Global Health is tasked to carry out CDCs in the Central African region. Thank you very much.
Good morning, everyone. I'm Dr. Elvis Amin, representing the Global Health System Solutions. Thank you.
Good morning, everybody. I am Dr. Ghadir Mohammed. I am the National Vaccination Officer at the Expanded Program in Immunization, Ministry of Health and Population, Egypt. And thank you for all.
Good morning. My name is Dr. Bassem Aissa. I am the Dean of National Tropical Medicine and Research Institute, briefly NHTMRI, and the Director of Egyptian Cdc. Nice to meet you.
Good afternoon, Dr. Ala Abdel Fattah, Ministry of Health and Population, Egypt. I'm Technical Officer at the Minister's Office.
Bonjour, je suis Dr. Omar Mohamed Ismail, coordinateur de la vaccination contre la COVID en République de Djibouti.
Bonjour, je suis M. Daoud Ahmed Ali, équipe logistique, déploiement et opération de vaccins contre la COVID-19 à Djibouti.
Bonjour, je suis Dr. Abdul Majid, responsable de la vaccination contre la COVID en Union de Comores et le point focal COVAX. Merci.
Bonjour à tout le monde. Je suis Dr. Mbufungu Nikezela, directeur de la prévention par la vaccination, point focal vaccination dans la coordination du COVID et membre du secrétariat de certification polio.
Morning, everyone. My name is Dr. Vandi Mohamed Alex Vandi, Director for Health Security and Emergencies in the Ministry of Health and Sanitation, the equivalent of MPHI, and also the Country Director for AFINET. Thank you.
Sierra Leone. Good morning. My name is Horace Nyandemo. I am the data manager for COVID-19 and also M&E officer for Child Health EPI Expanded Program on Immunization from Sierra Leone, Ministry of Health and Sanitation. Thank you.
Bonjour à tous. Je suis le docteur Alexis Mourou-Moyoka, directeur du programme élargi de vaccination et président de la commission vaccination contre la COVID-19 au sein du comité technique de riposte contre la pandémie à COVID-19. Et je suis donc chargé d'organiser toutes les activités de prévention des maladies évitables par la vaccination, y compris la réponse vaccinale à la pandémie de COVID-19 en République du Congo-Brazzaville.
Hello, everyone. My name is Al-Hakizman Jean de Dieu. I work as an AFI, Surveillance and Monitoring Officer in the vaccination program in Rwanda and the Rwanda Biomedical Center. Thank you.
Good morning. My name is Dr. Rebecca. I work with the African Field Epidemiology Network, also known as AFINET. We are a level 1 partner on the SLL program, specifically supporting HR for the SLL program at the Africa CDC and urgent country needs. Thank you.
I am Simon Antara. I'm director of AFINET. And as she said, AFINET is a level 1 partner. Thank you.
Hello, everyone. My name is Sarah Kosgei. I work with AMREF Health Africa based in Nairobi, and we will be supporting CVCs and also building the capacity of healthcare workers.
Good morning, everyone. My name is Mukhtar Abdi, the head of Vaccines and EPI program, Somalia Federal Ministry of Health. Thank you.
Bonjour tout le monde, je me nomme Hala Toko Wembo, je suis la directrice de l'Institut national d'hygiène du Togo et nous intervenons dans la vaccination anti-Covid, et les tests Covid et puis surtout le séquençage. Merci.
Bonjour tout le monde, je suis Dr José Yawa Apetiani, je suis la responsable de la vaccination pour la COVID-19 au Togo.
Good morning, everyone. My name is Dr. Agnes Chiraga. I'm from the Infectious Diseases Institute and Makerere University in Kampala, Uganda. I'm the head of statistics and data science and a senior researcher, and will be supporting the implementation science pillar under the SLL program. Nice to be here.
Good morning, colleagues. I bring you greetings from Kampala, Uganda. My name, and I work as the deputy head of the Global Health Security Department at Infectious Diseases Institute, Makerere University. We are very, very glad to be here, implementation science pillar, where I am the project lead. Thank you and have a good deliberations.
Bonjour tout le monde. Je suis Dr Tajidine Youssouf, médecin biologiste et infectiologue, point focal de l'Union des Comores auprès d'Africa CDC et membre du groupe technique consultatif pour la vaccination en Union des Comores et membre du comité d'évaluation des MAPI, manifestations post-immunisation, dans le cadre de la vaccination contre la COVID-19. Merci.
Thank you very much, colleagues, for the nice introduction. As this meeting is hybrid, we have colleagues online. So I will invite colleagues to introduce themselves from online. Kindly facilitate that team. I can't see any project their names. You can share on the screen.
Hello, bonjour à tous.
Don't have much people. So I will, okay. So I think from the list, okay. If you list them down, that will be good. So colleagues, can you introduce yourselves? Dr. Jane Medward, over to you, sir. Thank you.
Bonjour à tous. Je suis donc Dr Jean Médard Kankou, directeur de l'épidémiologie et de la lutte contre la maladie au niveau du ministère de la Santé et de la Population du Congo. Et donc, je suis en charge de la préparation et de la réponse aux épidémies au niveau du Congo. C'est à ce titre que je participe à cette réunion parce que la DLM fait office de l'Institut national de santé publique, donc au niveau du Congo. Merci.
Thank you. Dr. Jane, Neil, Botswana.
Good morning, colleagues. My name is Neo Muhua, Botswana Red Cross Society, the implementation lead for the Southern Africa Consortium. In the SLL project, we will be supporting with risk communication and community engagement. And Botswana Red Cross Society is leading 10 countries in the Southern Africa. Thank you very much. Enjoy your day.
Thank you, Botswana Red Cross. Aida.
Hello, good morning. Can you hear me?
Yes, we can.
Awesome. My name is Ida. Good morning to everyone here. Ida Nachaze from WFP. Within the SLL project, we will be providing the in-country logistics support as level 1 partners. And I'm happy to be here. I'll be joining everyone tomorrow in person. I'm still isolating, but I'm around. Pleasure to be here. Over.
Thank you, Aida. Amadou?
Yes, good morning all. I am Hamadou Modiwadiko, representing UNICEF organization. We are level 1 partners in the procurement and delivery of commodities up to the national vaccine store. I'm in Kigali. I will be joining you this afternoon. I'm pleased to see a lot of countries joining, including my beloved Mali as well. Thank you.
Thank you, Amadou. Swatini, Minister of Health.
Good morning, ladies and gentlemen. I'm Dr. Vusi S. Makakula. I'm the Director of Health Services in the Ministry of Health Kingdom of Eswatini. It's nice to have joined. Thank you.
Thank you, Eswatini Moich. Jaco Venta.
Yeah, good morning, participants. My name is Dr. Elijah Sinyenza. I'm the Project Director for Across Research. Across Research will support Eastern, Southern Africa regions to strengthen pharmacovigilance and safety surveillance systems. Thank you.
Thank you. So, Jaco, he's South Africa.
Morning. Yes, thank you for the introduction. My name is Jaco Venter. I'm representing
Hello, we lost you. Hello, Jaco, we lost you. I don't know. Is that?
Yeah, sorry, my microphone went dead.
All right.
We are supporting from South Africa, supporting the monitoring dashboards and monitoring dashboards. I'll leave over to Melissa, who's also.
Thank you, Jaco. He's South Africa. Botswana Red Cross, the second time. I don't know.
Good morning, colleagues. My name is Tepo Haratata. I'm the Programs Manager, Lead Applicant for Southern Africa, RCCE. Thank you.
Thank you. Botswana Red Cross, Omar Ismail. Hello, Omar Ismail. Okay, good. Let's move on to the next. We have also interpreters here with us, but let's move on. Team Tamara, Okay, that is Infectious Disease Institute. Okay, we'll move on to Moses Atuko. Moses?
Yeah, yes, good afternoon, Doc. My name is Moses Atuko. I work for Kenya Red Cross, a focal point for emergency health. I was in Morocco and Addis. We have 2 of our colleagues there already, so we will follow virtually from this end. Thank you, and over to you, Doc.
Thank you, Moses. Uche? Uche?
Good morning. Good morning, Dr. Marawi. Good morning, everyone. Unfortunately, I'm able to put on my camera. I'm having some issues with my system. However, Uche from the Africa Medical Supplies Platform, and for this program, we'll be supporting vaccine rollouts with procurement and distribution of PPEs. Thank you very much.
Thank you, Uche. Adiola Clark. Hello, Adiola. Hello. Clark, Adiola Clark.
Yeah. Good morning to all. I'm Adolfo Clark, EPR Manager, Liberia, the COVID-19 vaccine focal person for Liberia. Over.
Thank you so much. Melissa?
Morning, everyone. Thank you so much, Doctor. The name is Dr. Melissa Andrews, and I am representing the Health Information Systems Program with Yaku, who presented earlier. And our role really within the space threat now is to provide the performance management dashboards for the SLL program, and then also basing that on the DHIS2 platform. Thank you so much.
Thank you, Melissa. Tajuddin Yusuf? Here. All right, sorry. From the Zondo? Pumzile Zondo?
Good morning, all. My name is Pumzile Zondo. I'm also from Health Information Systems Program in South Africa, together with Yako and Melissa. And as they have indicated, we'll be supporting the establishment of dashboards for the monitoring. Thank you very much.
Thank you, Zondo. Let's move on to Beauty. Hello? Beauty? All right, let's move on. Georgina? Yabo?
Hello, everyone. Good morning in Ghana. Good afternoon to you. I'm Georgina Yabua, the Executive Director for the African Forum for Research and Education in Health. We are working together with the Infectious Disease Institute of the Makerere University on the implementation science for the COVID-19 rollout. Thank you very much. I'm very happy to be virtually present.
Thank you, Georgina. Daud Ahmed. Okay, Daud. All right, good. If not, I will move on to Eugenio. Hello? All right, so for the interest of time, I'm moving on. Horace? Oras? Okay, good. Let's move on. Dr. Moro? Dr. Moro, Brazzaville? Okay, it's here.
Dr. Merawi, it seems some people cannot hear you. So maybe check.
Hello, can you hear me now?
I can hear you, but some are saying they can't.
Okay, good. Dr. Moro?
Réactiver mon micro.
Okay, okay, sorry. Armel Onogo is here. George can, okay, this, okay. So.
Moi, je vous entends.
Almost everyone is here. I see Aster Sagai.
Good morning, everyone. Thank you, Dr. Marawi. Good morning, everyone. I am Aster from Addis Ababa University, representing the African Forum for Research and Education in Health, with our IDI people leading the implementation science on COVID-19 vaccine effectiveness and studying the enablers as well as hindrances of vaccination. Thank you and wish you a successful deliberations. Thank you, Dr. Marawi.
Thank you. So I will move on. I will invite whoever has not introduced himself or herself, kindly take the floor and introduce. For the interest of time, it is very difficult for me to track. Here on the screen, things are moving.
So good morning, everyone. I am Dr. Neka Onwu, a Director, Primary Healthcare Systems Development at the National Primary Healthcare Development Agency in Nigeria, representing the strategy group for the vaccine rollout at the National Primary Healthcare Development Agency for Nigeria. Thank you. It's a pleasure to be here.
Thank you, Dr. Neka.
Good morning, everyone. I am Yves Stephen Gallu from Cameroon. I am the Senior Officer, Community Engagement and Accountability. And what we'll be doing is in-country coordination within the Red Cross and Red Crescent movement of the Central African Cluster with this country, Cameroon. Thank you very much.
All right, good.
Morning, everyone. My name is Mateus Bizarria, and I am the Risk Communication and Community Engagement Delegate, working as well for the Red Cross movement across the region, and it's a pleasure to be with you. Thanks.
Thank you. Next.
Hi, everyone. My name is Simbrashi Mabaya. I'm a Senior Technical Advisor for Primary Healthcare with Gavi, the Vaccine Alliance. I'm supporting the scale-up of delivery of COVID-19 vaccines. It's a pleasure to be here. Thank you.
Thank you.
Morning, Dr. Marari. How are you today? And morning, colleagues. This is Chioma Wachuku. I'm also from Gavi. I am the lead coordinator in Gavi on the partnership with the African Union, as well as our work on policy for zero-dose children in Africa. It's a pleasure to be here again and participating in the workshop. Thank you.
Thank you, Chioma. Next. Next. All right. If I think if we exhaust everyone here, if there is anyone left, kindly, whenever you take the floor, introduce yourself about your organization, what role you are going to play in this SLL program. I see Chrissy. Yes, please take the floor.
Hello?
Yes, please.
Hello?
We can hear you. We can hear you, please.
Good morning, Dr. Merawi. Good morning, ladies and gentlemen. I'm Mr. Waja, staff member from Red Cross Côte d'Ivoire.
I'm very happy to participate at this workshop. Thank you.
Thank you so much.
Hello, good morning, everyone. This is Divine Mambone with the Global Health System Solutions Cameroon. So I'm joining my team virtually, and we're a level 2 partner tasked with implementing CVC and training of health workers in the Central Africa region. Thank you.
Thank you. Thank you, GHSS. Let's move on. If there is anyone. Good. If there is no one, kindly feel free to introduce yourselves whenever you get the chance to take the floor. So as you can see, we have all member states from West, North, East, and Central Africa region. We have almost 12 partners here. What's wrong with this thing? Almost 12 partners here. Phil, my request to you is in the next 3 days, kindly network, introduce yourselves about the program, how you are going to work on, learn, share experience among each other. That is our overall sense of the moral of this meeting and the sense of having you all here in Rwanda while we are learning from experience from Rwanda Ministry of Health vaccine rollout. With that, I will leave the floor to the moderator. Thank you. Thank you so much.
Thank you, Dr. Murray.
Oui.
Introduction.
C'est maintenant que ça va nous commencer.
Get involved with the processes.
Je viens. Calme-toi.
1 month. I will engage member states to get them on board and involved in our SLF program. Can you just send out for me, Sabina, so you can get Dr. Mohammed? Dr. Mohammed is going to do that. He's the head of the work stream on country engagement. And get in a few minutes.
Ok, d'accord, j'arrive.
Let's see, get Dr. Mohammed.
J'arrive.
Right after Dr. Mohammed gets through his presentation on the process of country engagement, then he comes, my energetic boss, will take questions. So reserve your questions for the 3 presenters. You're welcome.
Thank you, Dr. Fala. Are we putting on the slides? Next slide. Okay. Can we? Oh, thank you. Thank you so much. So let's take this time to look at an overview of the approach to defining country support from Africa CDC. I'm sure. Oh, okay, interpretation. Do we have interpretation now? Do we have interpretation? Do this. Voila. Merci beaucoup. So if you remember, sometimes in April, once the Africa CDC SLL program was launched, we held a meeting between the leadership of Africa CDC and the member states. And we did that in groups, in regions. So we started with East and Southern Africa region. Next, we did Central and North Africa region. And we ended with West African region. So That was the first of several consultations that Africa CDC undertook so as to be able to develop a bottom-up approach country support plan. We are very cognizant of the fact that we need to work, discuss, and align with member states as we set up to define what areas to support. And over the course of the several months following those calls, we've been able to go through this process to define the support for each of the member states. I know that there are some member states that were yet to conclude the country support plan. And I know my team, Senga and Dr. Falal, were still working very hard to ensure that no member state leaves this place without a completed country support plan. And in the event that we are to start implementation, we can start as quickly as possible. So what processes did we do? If you remember, we sent you what we call a preliminary need identification form at the very early stage of this, immediately after that call that we had with your permanent secretaries and ministers of health and director generals. So the forms were filled and sent back to us. And then at the Africa CDC headquarters, we have a team of experts that we assembled that looked at what you sent to us. And based on what you sent, we set up country engagement calls with all the member states separately. We were very busy within this period. And the essence is to align on areas of support for each country and choice of partners in collaboration with member states. So in those calls, if you remember the content of the need assessment form, it asked, which areas do you want support? What is the scale of the support you want? And how do you think this support should be given by Africa CDC? So what we did in the engagement calls with the teams, with your teams, the teams that the country it themselves nominated, was to walk through this submission and jointly agreed on how this support will be delivered within the objective of the Africa CDC SLL. You know, each program has its own rules and regulation. Okay, if you say you want us to buy you some vehicles, for instance, the Africa CDC SLL program does not allow us to purchase vehicle. So we say, what other alternative do we have? So it's not like changing what you ask for, but seeking the best way and the most efficient use of resources to be able to achieve it. This was what we did with your team, and we did it over the course of the last several months that passed. So for some countries, we did one engagement call. For other countries, we did 2, 3, depending on the issues that were raised and how many iterations are needed to come to a conclusion. In the end, we jointly agreed on what we call the country support plan. And that country support plan has a high-level budget to provide member state and implementing partner with the overall allocated budget in areas of support. So after your iteration with our operational team, our technical team, we have the budget approved by Africa CDC, approved by the funders for us to implement. So what next? And that is where we are today. That is why we are here today. We are here today to begin the processes that will enable us to begin implementation. By the time we leave Kigali, we want you to be clear on all processes that you need to take when you return home on the process of implementation. We don't want to leave anything in doubt. We want you to understand, and if you have any questions, please, this is where you ask. What do we need to clarify? So that once you go back home, we are all ready to start implementation. So, to start implementation, we have the high-level budget of an activity of country support plan. But we all know that we need to do more than that. And we've all been doing micro-planning. So we are here in this room with implementing partners that will be working with you, our distinguished member states. I'm very sure Dr. Marawi will take us later, right? The process Africa, oh, you've done that, Marawi? The process Africa CDC used in selecting the implementing partners. So we'll be doing that subsequently. When they come in country, the first thing they will be doing is sit with you to do micro planning. And the micro planning, like my boss, Dr. Taj, used to say, is going to be country-led. Because you know your problems more than anybody. However, our implementing partner, because they are vested with responsibility to support you to deliver this program, will support the process of the micro planning and will report to us the budgeting and the way forward. We will hold our implementing partner accountable for implementation of the micro plan. So what will be done immediately we get to the country is the micro plan, and then of course implementation can start. Do we have the next slide? So again, I will, in subsequent presentation, Marawi will talk more about this, but just to give you an understanding of when we talk about implementing partners, what are we talking about? Africa CDC divided implementing partners into two. We have the level 1 partners and we have the level 2 partners. What is the difference? The level 1 partners were chosen based on self-recognition. They are considered the best in the industry and been working on the continent for several years. And we do not think we could get a better partner to work with in that specific areas. So they were chosen based on self-recognition. And for those level 1 partners, we have Affinet, we have UNICEF, and we have Africa ASLM. So Affinet will help us with the workforce component. UNICEF will help us with procurement. ASLM will help us with pathogen genomics. We have level 2 partners. The level 2 partners were selected based on competitive bidding using what we call the objective review panel. In fact, one of the reasons why we are doing this a bit late is because Africa CDC took the decision that we need to use the international best practice in the selection of these level 2 partners. And to do the international best practice means we need to advertise, we need to give time for review, objective review panel, and then give the panel the time to do the right selection and then announce. So you will be seeing different, can you click? You'll be seeing different level 2 partners, and we selected them based on regions. Here we have West and Northern region and some countries, of course, from East and Central region. You will notice, like I said earlier, sorry, I missed out the World Food Program. It's also a level 1 partner. World Food Program will help us with also in-country logistics and movement of goods. Now, for risk communication and community engagement, we have the Red Cross as the level 1 partner, level 2 partners that we'll be working with. And the Red Cross also has been upgraded to a level 1 partner for West African risk communication and community engagement. So for vaccines, setting up COVID-19 vaccine centers, we have AMREF and GHSS. For West Africa, I think we're still awaiting. Then for safety surveillance, we have ACROS and sorry, my eyes is IRSF. How did I forget IRSF? So for which one again? Yes, and then for data will be helped there by HIPS South Africa. I'm sure I'm missing, like I said, for hiring workforce, we have Affinet, implementation science, we have who? Yeah? IDI. Thank you. So this is what we have. We will get more details about this before the end of this 4-day meeting. Please, if you have any question, listen, we are always here to answer. And like we said right at the beginning, Dr. Marawi heads the partnership work stream for this. He's always available for you to have questions, to respond to your questions and whatever you want us to discuss. Very importantly here, we want you to know and meet officials of the level 1 partner and level 2 partners that you will be working with in your country and begin to develop a working relationship. When we start implementation, it will be easier for us to just hit the ground running. Thank you, and let's open the floor for discussion. Yes, please.
Bonjour. I want to thank you for your intervention. You said that you work with Central Africa, and no, East Africa. You don't speak about West Africa. I want to know the reason. Okay.
You mean?
I'm from Côte d'Ivoire, West Africa. During your intervention, you speak about you work with the East of Africa and the Central of Africa. You don't speak about West Africa. I want to know the reason why for this project, this good project.
The what? I'm not getting you.
J'ai dit que vous avez dit que dans le processus, vous avez eu des rencontres déjà avec l'Afrique de l'Est et avec l'Afrique centrale. Voilà, donc comme je n'ai pas entendu parler de l'Afrique de l'Ouest, je voulais voir qu'est-ce qui explique ici ce petit retard ici de l'implication de l'Afrique de l'Est dans ce bon projet.
Merci beaucoup. So, we have partners in different regions. You can get me? You are getting interpreted. We have partners in different regions. If you look at the Red Cross, oh, okay, the slide has gone. The Red Cross for, I think Côte d'Ivoire Red Cross is responding for that of West Africa. I just cited example. It's not that it is not all exhaustive. So pardon me if you did not hear me call Côte d'Ivoire Red Cross, but it's there on the board, and you are our partners for West Africa. I did not exhaust all the list. Thank you.
Yeah, for the breakout sessions, I see that some countries are represented here, but are not listed for specific breakout sessions, such as Guinea-Bissau or Togo. Not sure.
We will address that and communicate.
Okay.
Yeah, apologies if some may not be in all. Not all countries will be in all breakout sessions, but we will address that and we will revert back. Yes, I think the first breakout session is in the afternoon today, right? So we will address that before the next breakout session.
Okay, so my concern is how involved are the regional collaborating centers with this project?
Excellent question, really. Thank you. At the very beginning, the regional collaborating centers were the people that helped to contact your because the concept of the Africa CDC regional collaborating centers is for them to enhance the implementation of Africa CDC strategy at the regions. So when we started, we worked very closely with Africa CDC RCCs for contacting the member states, the CSP in East and Central Africa and Southern Africa, where the RCCs are already fully operational. They were the ones that took the lead in development of the CSP. I'm coming. In development of the CSP. For West Africa, is we work with WAHO. So in the meeting we had that first introduced Africa CDC SLL to West Africa, that meeting was chaired by Professor Stanley of WAHO. And we've always worked hand in hand with the team in the Abuja office of WAHO to help us even in the reach out to some of the countries. WAHO has been very instrumental. Then for North Africa, we do not yet have a functioning RCC. So we are reaching out directly to the member states. Thank you.
Okay, thank you very much. Thanks for the good presentation and also sharing the background of the project. I'm representing Somalia. So we submitted the proposal of SLL to Africa CDC. We did not get any feedback about that or comments. So is there the process still going on or it is finalized? Somalia will be eligible to get this support. Also, the second question I want to add is that according to the partners selected, is there an engagement of the member states to maybe have some kind of involvement in engaging those partners? Thank you.
Oh, okay. Thank you, Senga, for making me understand. All the CSPs that have been finalized, we are waiting for this meeting, and then we will have some contracting to do, and then you get feedback on implementation. That's your question, right, Somalia? Yes. So we've received your CSP. We've finalized the CSP, and we will start implementation. But there was some other thing we were supposed to do with Somalia. which is to support you because we know that you are just coming out from a challenging situation. So I will send my team to meet with you and we can hear what are the things you need us to support urgently. And then we can work along with that. So let's meet maybe during tea break or lunch, and we can discuss that. Then talking about implementing partners, and again back to the question on the RCC, we actually deliberately used the African Union regions to align our response. And then the implementing partners were also chosen based on the regional approach. However, in terms of whether we worked with member states, like I told you earlier, we use what we call the objective review panel, and using the international best practice in the selection of implementing partners. If you need more information on that, you can always meet Dr. Marawi, who heads our partnership work stream of this program. Thank you. Yes.
Thank you. I would like to understand better the alignment between the country support plans and the micro planning process, as well as the implementing partners proposals as well in terms of the activities to be delivered, how that would all fit eventually. And if you can then clarify if the micro planning will be done for each of the areas that you have there, or if it's all combined into one single document with each and every area that the SLR will deliver. Thank you.
Excellent and very great question. First, so let me say that micro planning will be done based on the national plan, the country plan. This is very important, and I want every member state here present and partners to please understand this. Africa CDC is supporting the country national plan for delivering of COVID-19. So the CSP as developed is actually an extension of this national plan as seen by the member states. So they are only telling us this is the part of our national plan that Africa CDC can support to get us to where we want to be. So when you're doing the micro planning, you'll be using the national plan based on the caps that are given in the CSP. So as regard as how this translates to what the implementing partners submitted to Africa CDC, all of this was put into consideration when we were developing the CSP, because we have buckets of funding. And based on what you submitted to Africa CDC, Dr. Marawi and the team created those funding CSP. This is how much fund we need for risk communication. And it is what they gave to us that we use in developing this CSP. So they are totally aligned. And you will see that when you go in country and you do your micro plan and you get your indicative budget, when you come back to Dr. Marawi, you will see that there is allowance for that. Thank you. Yes, I hope we are doing well on time. Yes, please.
I just want to ask again, and I think my concern is more in line with the previous participant, and it basically has to do with the role of the partners, level 1, level 2 partners, and how their work aligns with or support the country support plans. What maybe I didn't get from the presentation, but what is the role of the level 1 and level 2 partners for this entire process?
Okay.
Are they the ones that will be doing actual implementations in country, or is a conduit through which the support will be sent to the country for the various areas?
Okay, a very good question. The role of the level 1 and level 2 partners is to support your national plan. They will support you, but they are accountable, and they will be the one that will report logistics and finance to Africa CDC and implementation. So if we say setting up CVCs, for instance, the country will tell, based on the micro plan, we want to set up 5 new CVCs and 50, I'm just making up figures, 50, we want you, Africa CDC to support 15 existing CVCs. So you will give all the infrastructure for that, and the implementing partner will pay for it, the ones that is budgeted. You, the recruitment, you will do the recruitment, the implementing partner will give the contract. So they will be supporting you in what you're doing. Does that answer your question? The accountability we will hold, the Africa CDC do not give country money.
No, I'm not talking about resources.
Oh, okay. So we will have a whole session on accountability. But suffice to say that Africa CDC will hold the implementing partner accountable. The member state will hold the implementing partner accountable. You understand? But I don't want to preempt that, because we have a whole session where we will be discussing that component, and then we will see how accountability flows. First, we will define what our performance indicators are, what the values of this program is, who will we hold accountable, and how do we ensure that we monitor the performance of the country, the implementation of the country support plan, and of course, the performance of the implementing partners. So all of this will be trashed out within the next 4 or so days that we'll be here. So I think we've gone over time, and let me thank all the, just very quickly, because we've really gone over time.
Très rapidement. En fait, on a constaté qu'il y a d'autres initiatives, notamment la COVAX, on a AVAX de l'Union africaine, et je voudrais savoir quelle est l'articulation de ce projet avec les autres initiatives. Je vais reprendre alors. Donc, je disais que quelle est l'articulation de ce projet avec les autres initiatives comme COVAX, comme AVAX de l'Union africaine en termes d'approvisionnement en vaccins? Merci beaucoup.
I am so happy I allowed this question. Merci beaucoup. Comment vous vous appelez? Ah, merci. For Africa CDC, the whole vaccines on the continent is Africa CDC vaccines. So we know on the continent we have vaccines that came in through COVAX, vaccines that came in through bilaterals, donation from the US government. When I was in Cameroon, we received quite a number of vaccines coming from the US government to that country. Vaccines coming from the AVAT, the African Union, vaccines coming from other multilateral individuals or institutions. For Africa CDC, all of these vaccines are Africa CDC vaccines. All of these vaccines will help us to achieve the 60% we want to achieve. We also are going to send in vaccine as part of the program to countries, but we do not discriminate any of those vaccines. Let me give you an example. We're supporting Sierra Leone with what we call the urgent support. And at a point in time, the AVAT vaccines we gave member states, J&J. Well, at a point in time, the Pfizer vaccine in Sierra Leone was due to expire at the end of this month. So we set up a mechanism that delayed the use of J&J, but complement the use of the Pfizer vaccine so that these Pfizer vaccines will not expire. Because any vaccines that expire on the continents, for us, is a waste. And it's a waste for the continent. And it will affect our chances of reaching 60%. So all of those vaccines, irrespective of source, is an African vaccine, and we support the delivery of those vaccines to our people. Thank you. So I think yes, Dr. Fala.
So you have the section, the moment we want to do the section. Moderate these two sessions.
Okay, so that's so I should moderate two sessions.
This session and
okay. Okay, that's the next one.
Yeah, you want to keep this before you?
Okay. Okay. So, colleagues, we will just go to the next. Can we? To the next session. So, can we continue? We're not perfect. Yeah, I like the spirit in this hall. We are going to session 2, where we'll be taking shared learning. First, we start with the Rwandan National Vaccine Program. It will be a panel discussion. The first presentation will be by the Rwandan National Vaccine Program and Supply Chain Management. And do we have Dr. Hassan here? Dr. Hassan? So he will be talking up to us on the Rwandan National Vaccine Program and Supply Chain Management. As soon as they bring him, maybe it's just outside. And then next, we'll be taking presentation on pharmacovigilance and risk reporting from Lazare Tirengenya. And finally, Dr. Albert will be telling us about the COVID-19 response in Rwanda. So for the next 1 hour, we have Rwanda showing us their experience in the COVID-19. But we will start with Dr. Hassan. Dr. Hassan, you have the floor.
Okay, thank you. Thank you, Dr. Mohammed. So my name is Sibaman Hassan. I'm Director of Vaccination Programs here in Rwanda. So I will be taking you through Rwanda's National Vaccination Program, and I will touch a little bit on the vaccine supply chain management. So it is a general overview of vaccination program here in Rwanda. Next slide, please. So this is the outline. We'll go through Rwanda routine immunization program overview, update on Rwanda immunization calendar, progress of national immunization coverage in Rwanda, HP vaccination program, because actually we are also vaccinating girls, and then COVID-19 vaccination status today, and then vaccine supply chain management. Next, please. Yeah, this is the summary of the whole EPI in Rwanda. So actually, as you can see, our EPI started in 1980. And you can see in the middle, it is just years of introduction of new vaccines. And at the beginning, actually, vaccination program was using only 6 antigens, traditional ones. And then starting 2002, we started to get the support from Gavi. And that was the era of introducing new vaccines. In 2002, we introduced hepatitis B and Haemophilus influenza, which was included to DTP, and then now we are using pentavalent vaccine. And then 2009, we introduced pneumococcal vaccine. 2011, we introduced human papilloma virus vaccine, HPV. 2012, we introduced rotavirus vaccine. And then 2013, we introduced rubella vaccine, which was added to measles vaccine so that we have a combined vaccine, measles and rubella. And then 2018, we introduced also inactivated polio vaccine. So in total, for routine antigens, so we are having 12 antigens. And as you can see, we have achieved a lot with new vaccine introduction, but also the good coverage for all antigens. So far we are using 12 antigens, and we have vaccinated so many girls against human papillomavirus. And most of these vaccines here are being supported by Gavi, especially those new vaccines, but of course, government is co-financing, and also for routine, other routine vaccine, traditional vaccine, government is procuring all of them 100%. Next slide, please. So this is our immunization calendar. As you can see, we are vaccinating even pregnant women. Now we are using TD, tetanus and diphtheria vaccine. And then from birth up to 15 months, we are vaccinating kids. And then at 12 years, we are vaccinating also girls with HPV vaccine. And as you can see, children are having all basic vaccines, but also these new vaccines. And we have started to see the impact, because actually, if you look at also the infant mortality here in Rwanda is very low compared to the last 10 years. Next, please. Next. Yeah, and then this is the trend of what we have achieved in terms of immunization coverage. As you can see the trend there, we have tried to compare different DHS since 2000 up to 2019, 2020. You have seen, you can see that the progress was good. In 2000, actually, the fully vaccinated children was 76%. And today, actually, we are at 96%. You are only missing 4%. So hopefully, in near future, also we can vaccinate all of them so that we don't miss any child, so that we can vaccinate every child without leaving anyone behind. And then these graphs also, you can see the coverage by each and every antigen, but also you can see fully immunized kids. As I have said, now we are at 96%, but you can see most of all antigens, actually we are at more than 90%, almost achieving 100%. Next slide, please. So that was results from surveys, but also here I wanted to show you what we have achieved in terms of administrative coverage. Next, please, so that you can have the full graph. Yes. Okay. Thank you. So you can see we have tried to show the trend since 2017 up to 2021. So it seems like in 2021 the coverage is low. But it is not true, because actually this is only for 11 months. So we are still having to add a number of children vaccinated during this month of December. So meaning that we expect also to have a good coverage exceeding 90%. So as an example, you can see 2021, measles and rubella second dose, now we are at 85%, but also it is the coverage for 11 months. So if we add the remaining month, so it means already it is possible to have more than 90%, so that we keep the same trend of having a good coverage exceeding 90%. So for this coverage of 5 years, so we have been able also to mobilize different awards from our partners and mainly Gavi, and we have been benefiting for 5 consecutive years, actually our what we call PBF, performance-based financing. And it helped a lot to invest in EPI infrastructure. So now I think we'll have time also to visit the EPI warehouses where we are keeping vaccines and also other devices. So actually we have built that new warehouses using those funds from PBF. Next slide, please. And then for HPV vaccination program, actually HPV, as I have said, it started in 2011, and now we are in 2021. Now it is 10 years. 10 years, and you can see the coverage was good since the beginning. So at the beginning, 2011, 2012, you can see the coverage was 97%. And then the following year, 97%. And you can see the coverage each and every year. But you can see in 2020, actually there was a slight decline in coverage. You can see the first dose 91%, and then the second dose 74%. So you can understand actually because 2020 was a critical year for vaccination programs because of lockdowns. And also if you look at the HP vaccination program, actually our strategy is to vaccinate using schools. And then most of the schools were closed at that time. So we had almost a year school closed. So it was very hard even to reach that 74%. Because actually we had to change the strategy. We vaccinated children in community, and it was not easy. But we think that this year, 2021, coverage will be good because actually today we are giving the second dose. So meaning that we are rushing so that children can go in holidays after getting their jab. So it will be a good time also to catch up those children we missed. So we have vaccinated so far more than 1.2 million since we started in last 10 years, since 2011 up to date. We have vaccinated so many girls. So meaning that we are on the good track to eliminate cervical cancer. Next, please. Then as update on the COVID-19 vaccination, so actually this slide, this is what is being published on a daily basis. Actually, all our population every day.